So I'm going to do a quick talk on inflammation of the iliotibial band, which is a common injury or condition seen in cyclists, and now that the Tour de France is on, often people are out cycling in the good weather. Essentially what the iliotibial band is a large sheet of tendinous material that unusually for tendons spans two joints, spans both your hip and your knee joint. And it's on the outside of your hip, radiating right down, and attaches just below your knee on the outer part of your shin bone, your tibia. Because it is unusual and spans two joints, it can commonly be affected with repetitive activity of your legs, such as cycling. In addition, the tendon tends to get less supple with age, and also as a lot of us sit at desk jobs such as I am now, that tendon can be relatively at its shortest length during the day when people are working. Then at evenings, weekends, when they go out and exercise, it gets extended to its maximal length and can be inflamed. Like I said, it's a common cycling injury in both amateur and professional cyclists. The symptoms you're likely to get initially would be pain, often at the outside aspect of your knee, and can radiate up towards your hip. This initially can be after you've been out for a long cycle, but as your symptoms progress, can be even during your cycling or pretty much straight away if it's quite severe. Usually for diagnosis we do, the history can be quite characteristic. We can do some simple investigations such as x-rays to rule out any other significant symptoms such as arthritis. And often the diagnosis is confirmed with an MRI scan. With regard to treatments, I always recommend people to keep a close symptom diary to find out what the relationship is between the symptoms and the exercise, and when during the exercise the symptoms develop. With regard to management, often exercise modification can be enough. Specifically with cycling, particularly if you use cleats and clip into your pedals, often the position of your foot in the pedal makes a significant difference. So if your feet are relatively in-toed, then that can cause inflammation around the outer part of your knee. Physiotherapy forms the mainstay of treatment, and mainly this involves letting it rest, lots of stretching, and that may involve a foam roller or something similar for deep massage on the outside part of the thigh and the knee. And usually over time this helps remedy the condition. But what it can be quite frustrating, and because tendons and ligaments have a poor blood supply, the time that it can take to heal can be several months, and it can significantly affect your ability to cycle or cycle a long distance initially, but it should not be ignored.